In this lab, we are going to focus on how nurses communicate with purpose. Communication is not just something nurses do between skills. Communication is part of the skill. The way we introduce ourselves, explain care, listen to patients, give report, and document information all affect patient safety and patient trust. This nursing mindset guide is designed to help you pause and think before you respond. First, let's review ISBAR. ISBAR gives nurses an organized way to communicate important patient information. You may use ISBAR when calling a provider, giving handoff report to another nurse, updating the healthcare team, or presenting patient information during clinical. Remember, the I stands for introduce. So here, you'll state your name, your role, you'll state the patient's name, their age, maybe even their room number, and why you are communicating. The S is for situation. So with situation, you want to think about what is happening right now. Why does this patient need attention? That's the situation. The B is background. So here you'll include the diagnosis, any relevant history or treatments or medications or events that matter to the current concern. The A is assessment. This is where you will include current vital signs, current assessment findings, anything that's changed, and what you have already done. The R is recommendation. So be clear about what you need next. Do you need new orders? Do you need the provider to assess the patient? Should the next nurse continue monitoring something? Should they be carrying out certain orders? Remember, ISBAR helps prevent important information from being missed. Next, let's think about therapeutic communication. Before responding to a patient, ask yourself, will my response encourage the patient to keep talking? Am I acknowledging their feelings? Am I providing information instead of advice? Am I helping the patient gain insight? Am I building trust? If the answer is yes, your response is likely therapeutic. If the answer is no, pause and choose a different response. Therapeutic communication includes techniques such as active listening, reflection, clarification, informing, silence, refocusing, sharing perceptions, suggesting, and theme identification. The goal is not to fix the patient's problem for them. The goal is to support the patient, to understand their concerns, and to promote patient-centered care. We also need to recognize communication roadblocks, things like giving advice, offering false reassurance, asking why, arguing, changing the subject, or giving personal opinions. Those things can shut down communication. Instead, listen, validate, clarify, reflect, and empathize. Finally, before every patient interaction, use a quick clinical communication checklist. Introduce yourself. Verify patient identity. Explain your purpose. Listen more than you speak. Adapt to the patient's needs. Verify understanding. Document objectively, and end respectfully. Remember, great nurses do not just perform skills. They communicate with purpose. So communicate with purpose, care with confidence, and make a difference.